1. Colorado AG takes action against Trump administration's ACA changes. 2. AG Kaul challenges Trump rule that threatens ACA coverage access. 3. Attorney General Bonta leads lawsuit against Trump rule threatening ACA coverage. 1. Colorado AG takes action against Trump administration's ACA changes. Imagine this, a rule change that could strip nearly 2 million Americans of their health insurance and make healthcare even more unaffordable for countless others. That's exactly what's happening now, as Colorado takes a bold stand against the Trump administration over new Affordable Care Act, ACA, regulations. The lawsuit, filed by Colorado Attorney General Phil Weiser, is part of a coalition effort involving 21 states. These states argue that the changes are not just harmful but potentially illegal. But here's where it gets controversial. What if these rules are actually about cutting government inefficiencies, as some Republicans claim? Or are they really just another way to undermine the ACA? Let's dive in. On Thursday, Colorado joined forces with other states to challenge a recently finalized rule from the U.S. Department of Health and Human Services, HHS, and the Centers for Medicare and Medicaid Services, CMS. This rule introduces several modifications that critics say will create significant hurdles for individuals trying to buy health coverage through the ACA, often referred to as Obamacare. Among the changes are new, burdensome and costly, paperwork requirements, stricter verification processes, and a shorter timeframe for open enrollment. These adjustments might sound minor, but they can have a major impact on people's ability to secure affordable healthcare. According to the AG's office, the effects won't stop there. They estimate that around 2 million people across the country could lose their health insurance altogether due to these changes. For context, consider how critical the ACA has been in expanding access to healthcare. Over the past few years, enrollment in ACA exchanges has surged nationally, with 24 million Americans now relying on this system, double the number from 5 years ago. In Colorado alone, more than 305,000 residents obtain their insurance annually through Connect for Health Colorado, the state marketplace. Of those, a staggering 80% receive financial assistance via federal subsidies to help lower their premiums. If the rule goes into effect, many may find themselves priced out or unable to navigate the added bureaucratic steps. And this is the part most people miss: the rule doesn't just tweak administrative details. It also excludes gender-affirming care as an essential health benefit under the ACA. This exclusion shifts the financial burden onto states like Colorado, which would then be responsible for covering the portion of insurance premiums tied to such care. With rising costs already squeezing household budgets, this move adds insult to injury for many families struggling to afford basic necessities. The timing couldn't be worse. Just one day before filing the lawsuit, Colorado announced skyrocketing insurance rate increases for those purchasing plans on the individual market. Statewide rates are projected to jump by 28%, while residents in the Western Slope region face an eye-watering 38% hike. Democratic leaders attribute this surge to cuts included in the Republican-backed federal budget bill, which slashed tax credits for individuals buying insurance through Connect for Health Colorado. Meanwhile, Republican lawmakers defend the administration's actions as necessary measures to reduce waste, fraud, and abuse within government programs. Attorney General Weiser sums up the stakes poignantly: at a time when Coloradans are grappling with sky-high living expenses, letting this alleged overreach stand would force thousands to choose between paying rent, putting food on the table, or keeping their health coverage. As a Democrat running for governor, Weiser frames the issue as both a moral and economic imperative. While CPR News reached out to HHS for comment, no response was received before publication. However, the silence speaks volumes, leaving critics to question whether the administration adequately considered the human cost of its policy decisions. The coalition's legal argument hinges on claims that the rule is arbitrary, capricious, and violates the Administrative Procedure Act. They're seeking an injunction to block the contested provisions from taking effect next month. Other states joining Colorado in this fight include Arizona, California, Connecticut, Delaware, Illinois, Maryland, Maine, Massachusetts, Michigan, Minnesota, Nevada, New Jersey, New Mexico, New York, Oregon, Rhode Island, Vermont, Washington, Wisconsin, and the Governor of Pennsylvania. Notably, this marks the 29th lawsuit filed by Colorado's Attorney General challenging various actions and executive orders issued during the Trump presidency. So, what do you think? Is this latest regulatory shift a reasonable step toward streamlining government operations, or does it represent yet another blow to accessible, affordable healthcare? Do you believe states have a responsibility to push back against federal policies that threaten vulnerable populations? Share your thoughts in the comments, we'd love to hear from you. 2. AG Kaul challenges Trump rule that threatens ACA coverage access. In a bold move to protect healthcare access, Wisconsin's Attorney General Kaul has stepped into the legal arena alongside a formidable group of states to contest a controversial rule introduced by the Trump administration. This rule, if implemented, threatens to dismantle key aspects of the Affordable Care Act, ACA, potentially stripping nearly 2 million Americans of their health insurance coverage. But here's where it gets controversial. The rule also proposes changes that could inflate the cost of premiums and out-of-pocket expenses for millions more, making healthcare less affordable and accessible than ever before. The rule in question, issued by the U.S. Department of Health and Human Services, HHS, and the Centers for Medicare and Medicaid Services, CMS, introduces several stringent measures. These include new verification processes and an automatic $5 monthly fee for all individuals automatically re-enrolled in plans that previously had no premiums. Such measures are expected to not only reduce the number of insured but also impose heavy financial burdens on those still covered. The attorneys general argue that these changes are not only arbitrary but also capricious, violating the Administrative Procedure Act by being contrary to the law. Since its inception in 2010, the ACA has significantly increased the number of insured Americans while reducing healthcare costs. Over the past 5 years, enrollment numbers have doubled, with over 24 million people signing up for coverage through ACA marketplaces for the 2025 plan year. However, the new rule threatens to reverse these gains with its restrictive policies, potentially increasing the uninsured rate in states like Wisconsin, where the individual market has seen record enrollments in recent years. The implications of this rule extend beyond just numbers. In Wisconsin, for example, a decrease in healthy individuals within the insurance pool could lead to higher premiums for everyone. Hospitals and federally qualified health centers, which are obligated to provide care regardless of a patient's ability to pay, could face increased operational costs as the number of uninsured rises. This is the part most people miss: the broader impact on community health services and the overall stability of state healthcare systems. The coalition of states, led by Attorney General Kaul, is not only challenging the legality of these changes but also seeking immediate relief to prevent these rules from taking effect before their scheduled implementation date. This legal battle underscores a critical standoff in healthcare policy that could shape the accessibility and affordability of healthcare in America for years to come. What do you think about these developments? Do you believe the ACA should be protected against such changes, or are there aspects of the rule that might benefit the system in ways not immediately apparent? Your thoughts and opinions are invaluable as we navigate these complex issues together. 3. Attorney General Bonta leads lawsuit against Trump rule threatening ACA coverage. Imagine a scenario where millions of Americans suddenly find themselves without health insurance, facing skyrocketing costs for basic medical care. That's exactly what could happen if a recent rule proposed by the Trump administration is allowed to take effect. This controversial rule, which has sparked outrage among healthcare advocates and state officials alike, aims to make sweeping changes to the Affordable Care Act, ACA, potentially stripping coverage from up to 1.8 million people. But here's where it gets even more alarming: the rule doesn't just threaten individual access to healthcare, it also places a heavy financial burden on states already struggling to manage their healthcare systems. California Attorney General Rob Bonta, alongside his counterparts from Massachusetts and New Jersey, is leading a coalition of states in a lawsuit against the U.S. Department of Health and Human Services, HHS, and the Centers for Medicare and Medicaid Services, CMS. The coalition argues that the final rule issued by these agencies is not only unlawful but also arbitrary and capricious, violating the Administrative Procedure Act, APA. At the heart of the issue are significant changes to the ACA marketplaces, changes that would erect barriers to enrollment, increase out-of-pocket expenses, and exclude essential services like gender-affirming care from being classified as an essential health benefit, EHB. The Trump administration itself estimates that this rule could cause up to 1.8 million Americans to lose their health insurance. For context, that's roughly equivalent to the population of a major U.S. city like Phoenix or Philadelphia. Beyond that staggering number, millions more would face higher premiums, co-pays, and deductibles, making healthcare less affordable at a time when access to medical services is more critical than ever. Some of the most concerning provisions include new verification requirements that add layers of red tape, shortened enrollment periods that limit opportunities for people to sign up, and automatic monthly charges imposed on consumers who qualify for $0 premiums but are automatically re-enrolled. And this is the part most people miss: the ripple effects of these changes extend far beyond individuals. States like California, which has approximately 2 million ACA enrollees, one of the highest numbers in the nation, would bear the brunt of increased costs. With fewer residents insured through federal exchanges, states may see spikes in Medicaid spending, uncompensated emergency care, and other expenses tied to supporting newly uninsured populations. It's a domino effect that threatens to destabilize state budgets and strain local healthcare systems. Attorney General Bonta minced no words in criticizing the rule, stating, "Far from delivering on their promises to drive down costs and make America healthier, the Trump administration's HHS and CMS are doing everything they can to make healthcare harder and more expensive to obtain." He went on to highlight how the rule imposes unnecessary hurdles, such as junking affordable premium options for some consumers and complicating enrollment processes. In response, the coalition isn't just filing a lawsuit, they're also seeking preliminary relief and a stay to block the rule from taking effect before its August 25 implementation date. To fully grasp the stakes, consider the broader context. When Congress passed the ACA in 2010, it was designed to expand health insurance coverage and reduce healthcare costs. Over the past decade and a half, the law has largely succeeded, with annual enrollment doubling over the last 5 years alone. By plan year 2025, over 24 million Americans had signed up for coverage through ACA exchanges, many receiving subsidies to make their plans affordable. Now, with open enrollment for plan year 2026 just months away, the timing of this rule couldn't be worse. If left unchecked, it could undo years of progress, leaving millions without insurance and driving up costs across the board. But perhaps the most contentious aspect of the rule is its exclusion of gender-affirming care as an essential health benefit under federal exchange plans. While this change wouldn't directly impact states like California, where such care remains protected, it shifts the financial responsibility onto states to cover portions of related insurance premiums. This move raises important questions about equity and access. Should healthcare policies prioritize inclusivity and comprehensive coverage, or should cost-cutting measures take precedence, even if they leave vulnerable populations behind? In addition to California, Massachusetts, and New Jersey, the lawsuit includes attorneys general from Arizona, Colorado, Connecticut, Delaware, Illinois, Maryland, Maine, Michigan, Minnesota, Nevada, New Mexico, New York, Oregon, Rhode Island, Vermont, Washington, Wisconsin, and Pennsylvania Governor Josh Shapiro. Together, they form a united front against what they view as an unlawful assault on the ACA. So, where does this leave us? As the legal battle unfolds, one thing is clear: the outcome will have profound implications for millions of Americans and the future of healthcare policy in the United States. Do you think the Trump administration's rule is a necessary step toward reform, or does it unfairly target those who need help the most? We'd love to hear your thoughts. Please share your opinions in the comments below. For those interested in diving deeper into the details, copies of the complaint and motion for preliminary injunction are available online. You can read the full complaint here https://oag.ca.gov/system/files/attachments/press-docs/cms%sign20rule%sign20complaint.pdf, and the motion for preliminary injunction, here. https://oag.ca.gov/system/files/attachments/press-docs/ecf%sign20%sign20 memorandum%sign20 ISO%sign20 mode%sign20 for%sign20 prelim%sign20 inj%sign20 and %sign20 stayed.pdf.